Hello my friends, this is Ati and I'm here again to talk about a huge achievement, so please subscribe and hit the road. Today, performing a head transplant is one of the main concerns of doctors. One of the main obstacles in such a transplant is the inability to transplant nerve tissue and connect the spinal cord to the brain, because the damaged nerve tissues are not able to properly transmit brain signals. In connecting the spinal cord to the brain, the head must be able to control the new body. On the other hand, this action is very difficult because if the brain is left without oxygen for a long time, it dies. According to doctors, Suleiman's head was almost completely severed from the end of his neck. Oh my god, that was so terrible. This teenage boy underwent a difficult surgery that took several hours and was performed by a special care team. A group of doctors in Israel reattached the head of a Palestinian teenager who was hit by a car while riding a bicycle. 12-year-old Suleiman Hassan, a Palestinian boy from the West Bank, suffered from a problem called internal decapitation, a condition in which the bottom of the skull and the top of the spine are separated from each other, but the skin remains intact. In decapitation mode, the head is completely separated from the body, but internal decapitation occurs when the ligaments and muscles that hold the skull in place on the topmost bone of the spine are torn by a sudden blow. This injury is very rare, so that its share of spinal injuries is less than 1%. It is not clear exactly how common internal decapitation is, as 70% of its victims die on the spot or on the way to the hospital. Performing this surgery is possible only if the main blood vessels are not damaged, because the blood flow to the brain should not be interrupted. To fix this injury, the skull and spines are connected together using medical rods, screws and plates, and possibly bone grafting. According to Suleiman's surgeons, this surgery was very complicated and took several hours. In addition, they used new medical plates and stabilizers in the operating room. They emphasized that the success of Suleiman's surgery was due to both their knowledge and the use of an innovative technology. After performing this surgery, the patient undergoes rehabilitation to regain the strength of his neck movement. Suleiman has been discharged from the hospital with a neck splint and will continue to be under the supervision of doctors during his recovery. He has no neurological damage or sensory or motor impairment and can walk without assistance. I hope we will never witness such events. Now, please subscribe my channel before leaving and don't forget to take care.